Okay, hello everybody. Today we'll be talking about Lyme disease. Lyme disease is caused by the Spirochete borrelia burgdorferi, and this is a tick. So it's a tick disease. The Lyme disease does not need any prophylactic antibiotics, but once you have been bitten by the tick, then a lot of features could occur, and these features depend on the incubation, which is then divided into early features or late features. So presumably you have been bitten by a tick, and this tick is the burgdorferi, and this burgdorferi borrelia tick, if it's less than 30 days, it gives us the early features, and these early features are mostly compromised by the erythema migrans. That is like a skin rash, and this is present in 80% of the patients, and this occurs about 1 to 4 weeks after tick bite. The important thing about this is that the Lyme disease, after seeing this feature, you should start to clinically diagnose Lyme and then start your treatment immediately just by seeing the skin features, which is called the erythema migrans, or the bullseye. Okay, the bullseye. It's painless, it's more than 5 centimeters, and it could increase in size. Okay, another thing is the systemic features, which is like headache, lethargy, and fever, and arthralgia. All of these are approximately in less than 30 days, and these are called early features, while the late features occur 30 days and beyond. These late features compromise the cardiovascular system, which the patient can come by heart block, and the nervous system by facial nerve palsy, radicular pain, or meningitis. So if there is no erythema migrans, the investigation of choice is ELISA to find the spirochete, and if I find it positive, I will start my antibiotic, and if it's negative and I'm still suspecting it very high, I'll retest in 4 to 6 weeks, especially with the people with other symptoms, and this retest will be using the immunoblot test of Lyme, and if that is positive, then I will start the treatment. So as I said, it is an infectious disease. It does not need any prophylactic antibiotics. It is a tick-borne disease, and it is carried by the Spirochete borrelia burgdorferi. And let's summarize this. The features are early features and late features. The early features are less than 30 days present, which comprise erythema migrans and systemic features. And we also have more than 30 days. These are the late features. A diagnosis is by ELISA. So if you're wondering what's the treatment is doxycycline. And if the woman or the patient is a woman and is pregnant, then of course we will not use doxycycline because it is contraindicated, and we will use amoxicillin, and this is in the early disease, and this is the confirmed disease. But if there's a more disseminated disease, we're going to give the ceftriaxone. One very important note is that there could be a reaction after starting the management, and this is called the Jarisch-Herxheimer reaction. You can go and look for that. This is Jarisch Herxheimer, which is like a fever rash and tachyarrhythmias. This is with the first dose of antibiotics, and this is common in many spirochete diseases, especially when in the treatment of syphilis. Okay, that's a wrap for Lyme disease today. That was a summary. There's a lot more to read on it, but this is just the summary for those folks who still don't understand Lyme disease in particular.